Assalamualaikum, Bismillahirrahmanirrahim. So video station Sydenham Chorea. So in the so first of all the video may be this like yes first the video. Yes, so in the video I can see a 10 years old girl in home setting, non-dysmorphic, alert, and she is on wheelchair. She whenever not attached to any device, and but whenever she is talking, there is dysarthria is present, and abnormal movement of the tongue is present. And the child is not able to fix his her tongue in and out. And I noticed there is some movement, jerky movement in her extremities, lower limb. So considering this, my differential diagnosis, it may be Sydenham Chorea, it may be cerebral palsy, chorioethitoid type. However, I don't notice any contracture there, and the child is mentality is very good. I think as not developmental delay I found no macrocephaly, and it could be ACL, but I couldn't appreciate any kind of rash or arthritis there. It may be Wilson disease, but I don't notice any jaundice or features of chronic liver disease. It may be following medication, metoclopramide, and then it may be due to any kind of degenerative disease, Huntington disease, or Moya or Leishman disease. But I can't appreciate any kind of self-injury mark on her extremities, and it may be benign familial chorea. So, what history, onset, course, and duration of this? And is there any presiding upper respiratory present or not? And if is there any family history is present or not? And was there any breathing difficulty? And is there any fit present or not? Detail detail perinatal history. And is there any arthritis or present or not? And medication history and developmental regression present or not. And examination, airway, breathing, circulation, vitals, and especially the blood pressure monitoring. And skin survey examination, is there any self-harm mark present or not? Then neurological examination, especially looking for the hypotonia in the hand, looking for yeah, that any milk made grape present or not, for hypronate sign is present or not, and in the lower limb hypotonia and tone of the patient, and the babiness sign, and cardiac assessment, and also for the per abdomen is eye examination, sunflower cataract slit with the slit lamp examination, case of flesh ring present or not for Wilson disease, and per abdomen examination also for chronic liver disease in Wilson. And now the investigation, if it is Sydenham Chorea, according to the modified Jones criteria, if only the chorea is present, it is sufficient to diagnose. It is one major criteria is sufficient, and there is a presiding history of upper respiratory infection. We can say their ASO titer. MRI may be done, and to exclude other Wilson disease, chorioethitoid cerebral palsy, or SLE, we will do the investigation according. accordingly. So what will be the management plan if it is Sydenham Chorea? So if it is the Sydenham Chorea, so management plan, I will involve my consultant neurologist, and liaise with school and support group. Here the drug of choice is phenobarbital. If it is not responsive, haloperidol chlorpromazine may be used there. And where the treatment should continue the lifelong. But here it is differ guideline to guideline, that is there any prophylaxis needed or not. Regarding the prophylaxis, actually, if it's carditis or cardiomegaly, if rheumatic fever with without carditis, so the prophylaxis with benzoyl penicillin or erythromycin should be 5 years or 21 years, so which one is longer. But if there is a rheumatic fever with carditis but no residual heart disease, so duration of this is 10 years or 21 years, which one is longer. Or in case of rheumatic fever with residual heart disease, 10 years or 40 years or lifelong prophylaxis is needed. Thank you very much. Assalamu alaikum.